With Glenn, Angel and Tim
I know which one I'd rather wake up looking at.
on Kiss 92.
Good morning, Singapore, and welcome to the Big Show. We are on YouTube, and we are on Facebook, and we are live right now with Dr. Martha Lee, Sexologist.
Sexologist, I like that. Welcome back, Dr. Martha.
Thank you.
Thank you so much for coming into the studio once again. Today you're coming in at a very special time of the year because October is Breast Cancer Awareness Month. And, it's all about pink, but not just about wearing pink, about creating more awareness about the disease.
Yes, so October is a very special month for me. It's Breast Cancer Awareness Month, but it's also my birthday month.
Oh, happy birthday in advance. wait, in advance, not yet, right?
Yeah, in advance.
I will sing you a birthday song in a while.
With that voice, too.
Yes. Well, you're
Okay,
gonna do a
thank you.
birthday. Are you going to do a birthday dance as well?
That's not important. I'll just sing. Okay, sorry about that, Martha. Carry on, please.
Yes, it's my birthday month, and it's also the month that my mother passed away. 10 days after my birthday. So now it's like a bittersweet kind of experience every month. Yeah.
When did you lose your mother, if you don't mind me asking?
Wow, like 7 years ago.
And it was from breast cancer.
Yeah, from breast cancer. So she passed away with stage 4 breast cancer. The cancer spread to her lungs and her bones. But she's a fighter, so she was first diagnosed when I was 19, and that's with stage 2. And then she went into remission, 10 years, nothing, and then boom, suddenly, it came back with a vengeance. So yeah, she fought it, and she went through many rounds of chemotherapy. It was really devastating to see somebody that is so strong and brave and loud becoming a shadow of herself. So yeah, this is why I think cancer really is very, very important to me, to be able to support survivors. And I'm so happy that I'm the sexologist for Singapore Cancer Society. Is something that I really cherish this role, so that I can support survivors on their journey.
Now, Dr. Lee, and now I'm going to be, when I call you Dr. Lee means I'm serious already. Okay, so, there are many people who have lost their parents, to cancer. Not necessarily breast cancer, but to cancer. How did the loss of your mom affect you psychologically? Because I've seen many people who have lost their parents who just don't find it so hard to get over it.
Yeah, I think grief comes in many, many layers. My mom wasn't the easiest person to be around, and I thought that when she passed away, it's the end of her suffering. So in a way, because seeing her suffer for so long, I kind of was really having anticipatory grief. So the grief just kept coming and coming. So I think being able to do something about it, support people, is just very important to me.
Right.
So you were grieving before she even passed away?
Yes.
Because you knew that was going to come.
Yes. And the thing is, the last year of her life, every single time like I took a proper look at her, she was becoming smaller and thinner. And I remember that year I somehow managed to get a lot of pet sitting gigs. So I was away from the house, and every time I was away from the house, I would what I call collapse, and I would find myself crying for no reason.
Away from her.
Yeah, because how dare you cry in front of someone who's going through so much?
Right.
So I was just holding it in.
You almost feel ashamed, right?
Yeah, I mean, it's like it's about supporting the person who has cancer, going through something so tough. So yeah, you kind of minimize yourself, and I didn't even know what I was doing, and it took me a while to realize actually I was really grieving before she passed away.
Okay.
It's so tough.
Yeah,
It
caregiving is hard.
so tough. All right, let's continue to talk to Dr. Martha Lee on The Big Show TV. Meantime, here's Selena Gomez. Call Me When You Break Up on Kiss 92.
Your call has been forwarded to an automatic voice.
Well, Dr. Lee, thank you so much for being so candid with us. I do want to ask
See,
you,
she's
though.
not just a sexologist, she's a psychologist.
Yeah. When
Counselor.
obviously
Counselor.
with your mom suffering from breast cancer and all that, whenever we talk about breast cancer, we also talk about family history and all that. You've now lost your mom to breast cancer. Do you fear for yourself that you are also susceptible to this?
Yes, definitely. My sister, in fact, was diagnosed with stage 0 breast cancer, and so she went through biopsy. So yeah, there's a genuine fear in the family that we will have breast cancer or cancer. And I've been told this, ever since I was 19 when she was first diagnosed, and started going for mammograms very, very early. And so yeah, it's a very real fear that you have, which really makes me go deeper into asking myself, what do I want to do with my life, and being able to really appreciate being alive. Yeah.
But to you and your family, I just want to say this: Choi, don't worry, y'all be fine.
As cancer is awful already, but breast cancer for women can be almost like a double whammy. Because it affects your looks, it affects your whole femininity. Can be stripped away. I know it's very, it's not a nice thing to say that I'm going to say that looks don't matter, but we've been brought up all our lives to say that impressions count and all that. How hard is it for women who go through breast cancer psychologically and physically, whether they survive, whether they go into remission or not? How hard is it?
Yeah, I noticed that the cancer survivors who come to me for counseling, they are very conscious about their breasts or lack of, and are very concerned about people staring at their breasts. They're very worried about being naked in front of their partner. They do not know how to have sex anymore, and so it is a very real thing, because it's a part of your body that suddenly is gone, and you have this where is it? You have a lot of grief, and there's also this phantom kind of thing happening where they think it's there when it's not, and so it just keeps triggering you again and again.
Yeah, and I mean, the boobs are the symbol of women. I mean, I hate to say it, but that's the first thing that when you draw a woman as well, besides the hourglass
hips,
shape, it's the boobs, right?
And there might be some people out there, people who are very base, right? Mainly guys, who are probably going to go, okay, so supposing you had breast cancer, you had to go for maybe a double mastectomy, but then you can go for reconstruction where you can get implants done and all that, and you'll be sexy again. But it's more than just that, right?
Yeah, it's more than that, because it also doesn't look realistic, and then there's scars which will be there, and it will just never look the same or feel the same.
I think,
and it's a big part of the expectation also. Like, they thought everything will be okay, but actually it will never be the same.
I mean, if you think about it from a guy's perspective, knock on wood, you had to lose any part of your anatomy that's related to your sexuality. That's what women are going through.
Of course. I mean, us guys, look, I mean, if I'm constipated, I feel unsexy already.
Yeah, exactly. Exactly. Yeah.
We can only imagine how difficult it is. Which is why I think, family and friends who give them support, love them for who they are. Maybe they might have husbands or boyfriends and all that. Just continuing to love them, make them feel good. That's so important.
Yeah.
So what is the role of a sexologist in the world of breast cancer?
Yeah, I really want to say that I'm very proud of my role at Cancer Society, and they are really the pioneer in Singapore, because they were talking about it way before anybody else in Singapore was. So I'm so happy to be part of it. And as a sexologist at Singapore Cancer Society, they promote often internally referral, because we have a rehab, we have a nutritionist, we have dietitian, we have all these comprehensive services to support people on their entire cancer journey. So when I get those referrals, they usually come in telling me that they have no sex drive, and when are they going to get it back, and what should they do? So they often have painful sex. They often are very afraid because the vagina does atrophy due to less estrogen, and so what happens is it's dry, it's painful, they do not know what to do. So imagine the foundation of your body is weak, and every step you take is just like you can feel this discomfort, dryness, tearing sensation. So this is where you educate people on what kind of products they can use. And the challenging thing is, even when I educate them...
Okay, hold on. Okay, we're going to go on there. I'm going to ask you that question again.
Kiss Kiss 92 traffic.
On the TPE towards the SLE after Tampines Avenue 7, avoid lane 2. An accident has been spotted. Also on Lower Delta Road, another accident after Ayer Raja Expressway, which is basically the AYE. Avoid lane 2. This is in the direction of Jalan Bukit Merah. Finally, on the AYE towards the MCE, a vehicle has broken down at Tuas West Road entrance. Wherever you are, stay safe.
Welcome back to The Big Show and The Big Show TV. It is Breast Cancer Awareness Month, the month of October. We have with us sexologist Dr. Martha Lee here today. And Angel, you were asking Dr. Martha just now. It was Tim.
About the role of a sexologist with the Cancer Society. And you were saying that, you will get referrals. Usually these breast cancer survivors, they will come to you complaining that now they have no more sex drive, it hurts. And what do you usually tell them? Or what do you promote to them?
So actually I work with all people with cancer at Cancer Society. For women, mainly breast cancer. For men, mainly prostate cancer. So yes, they come in and they want to fix their sex drive. They want to be able to have sex. They do not know whether they will be able to. They are scared. They finished their treatment and now their partner is pressurizing them or asking them when they can resume sex. So yeah, it's very scary because they have been going through firefighting, going through the treatments, just coping day by day, and there's the additional pressure to have sex. So what I do with them is we talk about what's going on, how they're feeling. So that's the emotional, psychological part. And then we do have some devices that we give them. We have a vaginal moisturizer, we have lubricants, we have sexual aids to support them to be able to feel more comfortable with their bodies so that they can have that bridge to be able to feel more confident before trying to have sex with their partner.
Do you have this conversation with both of them or just one?
Yeah, so I work with whoever I can, and actually a lot of partners, they feel so helpless because they do not want to pressurize the person with cancer, and they do not know what to say, they do not know how to say it, and so there's a lot of suffering in the relationship because both trying to be nice to each other, tiptoeing around this topic, and it's very difficult when of course sex being a very challenging taboo topic. So if you haven't been talking about this easily, it gets even more challenging with cancer. And of course, a lot of my clients with cancer, they tend to be older as well. So there's sometimes also the language challenge. My Mandarin is okay, but could be better. So yes, there's multiple challenges.
I mean, even without cancer already, some couples have
problems,
problems in
Very
terms of their
uncomfortable.
sex life. In fact, there are so many people, I'm sure, who are listening in right now thinking like, in a situation like that where cancer is involved and all that, you guys still want to have sex, man?
Yeah.
I'm sure people are thinking that, right?
Yeah, I think as a sexologist, when people find out what I do, sex counseling, sometimes they are a bit judgy and then they go, ee. But when we talk about sex and cancer, they're like, oh, yeah.
Now it makes sense, right? When it comes to cancer, I know we're talking specifically about breast cancer because it is October, but prostate cancer is equally hard. What you've seen both sides of it. It's not a competition, but between the men and the women, who deals with it better when it comes to being able to, say, move forward with their sex drive or heal quicker?
Yeah, I think the lack of sex education does, and also sexual conversations does affect our sexual attitude. And so what I notice with a lot of women, and I'm generalizing, is that once they have difficulties, they want to stop. They feel that it's not the most important thing. It hasn't been the most important thing in their lives. And they also do not see sex as part of their identity. Whereas for men, because they use their penis to pee and all that, they touch it several times a day, actually is a big part of their identity. So when their penis starts to atrophy, they feel less of a man.
Right, okay.
Right.
That's
Okay.
it.
All right, let's continue to talk to Dr. Martha Lee on The Big Show TV. It's 8:19.
Kiss 92 Time Check brought to you by...
So men feel like they've lost their masculinity more than women feel like they've lost their femininity.
So a lot of them actually feel because their sexuality is so important to them, they're really willing to come in earlier and do the work around it, as opposed to the women who just
They can live without it.
yeah, they can live without it, and the only reason why they're coming is because their spouse is asking for them, and they are worried that their partner is going to cheat on them. And what about the sanctity of their relationship and their family, their kids? And so they are more doing it because of the pressure of keeping the relationship together.
Wow, for everyone else and not just for themselves.
It's so hard.
Wow.
So I mean, when do women usually lose their interest for sex? Is it after menopause or what?
I think a lot of women, once they have difficulties, pain, discomfort, they get scared, and then it's
Yeah.
easier to just avoid it.
Right.
When in reality, with some adaptations, you can have and be sexual until the day you die. So it is really about adaptations. It's the lack of knowledge and information, I think, that causes the most suffering. And even when I tell my clients about what they can use, how to use it, and reassure them, support them, encourage them, because of all the other things they're going through, I think often they just like avoid it totally and sit on it for months. So I do try to follow up with them.
I mean, it's already a taboo to talk about sex. Next,
Yeah.
you want to say, come, can we use a lubricant? You know what I mean?
Exactly.
It's just because already the sexual part is not there. They don't have that healthy sexual relationship. So speak
Yeah.
about
Yeah.
AIDS is a bit harder, I feel.
It's
Now-
hard because they don't feel like it.
Right. And obviously, this is probably a very, very big topic. But I mean, if you could just give us a little bit. Someone comes to you and they go, look, my body's gone through all these changes. I don't feel sexy anymore. I'm not comfortable in this body now. This body I did not grow up with. Well, how do you get them to be more comfortable with their body?
I think the first step is to acknowledge all the things that they are feeling, because it's one thing to do things and move things along, but I think sitting with it and accepting it and being able to grieve is so important. A lot of times they have friends, well-meaning people telling them just move on, or your treatment is over, everything is okay, but there are a lot of other things that keeps coming up again and again, like for instance the follow-up treatments, and then they find out that there's another thing growing and things like that. So what I do is besides talking through with them, sitting with them, crying with them if it does come up, and helping them to take small steps. Like for instance, how do they feel like when they look at themselves in the mirror? Why are they still wearing those things that they don't have to anymore? The corset and things like that. So being able to support them and give them like small little suggestions to move things along.
Like building their confidence.
Have you ever told them just switch off the lights?
Yes,
It
so
doesn't help, I feel.
No, I mean,
I feel
some-
like, yes, I try. And what else can I say, right? Because I can say, oh, penetration, they don't have to touch or even look at your breasts. You can wear lingerie. But still, it doesn't help the self-consciousness and the emotions that come up.
Yeah.
Because it was part of their sexual routine. And now something is disrupted and they just feel very, very uncomfortable.
They feel very unwomanly because, I mean, you can switch the lights off, but your internal is still going to feel unsexy.
Right.
Because say your boobs are not there. You've
So
got
once again, I'm talking about
scars.
like people who are not stricken with cancer and stuff like that. They
Even
are all
then,
very
yeah.
image conscious as
Yeah,
well.
for
Most
sure.
of them when they have sex, they switch off the lights.
Yeah, for sure.
And I mean,
Yeah.
even from a guy's perspective as well. I mean, if your lady is feeling unconfident about her body, she's not in the mood. Sure, I guess she can give it to you, but you're also going to know she's not really into it, right? And that's also going to affect your willingness
That's
to kind of
true.
go through it as well.
And it's going to make it an unpleasant experience for
Yeah.
the woman. So why would you want to do that,
Yeah.
Yeah, it's the same, right? They've been doing it their whole lives, which is doing things for other people, and this is just yet another thing, and they are already very, very overwhelmed. So yes, there is resentment, and there's also a lot of other things coming up, which actually is also a moment where they can really dig deeper into who they are, what they want.
So in your experience, like counseling people, who is more at fault, the man or the woman?
I don't think it's
not a
anybody's
fault thing.
Martha baby.
It's not a fault thing.
No,
Yeah,
wait,
it's
there
not a
is
fault
always a
thing.
fault thing. What do you mean it's not
Okay,
a fault
okay,
thing?
Martha,
There's
Martha,
always
you
a fault
answer,
thing.
you answer.
It's like happy wife, happy life, right? So if the wife gives you some kind of look like, don't ask me for it now, the guy will back off already. What do you think?
Yeah, I
Greta?
think there's a lot of history that happens in a relationship because there's societal norms, there's all these gender roles. So there's a lot of things that builds onto each other. So this is where it gets very uncomfortable because you're already going through so much. You may not want to rock the boat. You may not want to recognize that there is a need to start to change. And I think the keyword change is so difficult for so many people.
Yeah.
So yeah, fault. I would say it's a lot of times is what we internalize. I don't think
Right.
it's really truly anybody's fault.
It's cancer's
Yeah.
fault.
The guy is always ready. Most guys are always ready, right? But it's the wives who are starving them of sex.
Oh, see, this is what we have to deal with.
Okay, this is
and
what
that's
Glenn does.
where and that's where the fight and the problems start.
When there's no sex.
Yeah, can you imagine
The
if a wife
frustration involved.
doesn't get? I'm saying this for all the men who are tuned in right
He's
now.
speaking on behalf of all
Of course.
mankind. Yes.
Yeah, and then some women will just go like, okay,
Don't
you know,
point-
like
don't point at me
like I
when you-
mentioned it the other day, right? It's like, oh yeah, what you need to release her. You go and play with yourself, lah. I heard this from Angel actually.
Rubbish! I've never said that. Oh my goodness.
See, that's disrespect already, correct? You know, then that will kind of like turn the husbands
But
off.
it is disrespectful for sure.
Poor husbands.
But you would never say that. I mean, as frustrated as you are, to your wife, if she had just gone through something like cancer, right?
Of course, no.
You'd
So I'm
never
not
be
talking
able
about
to do
cancer now.
that,
Now
right?
I'm not talking
He's
about cancer
forgotten about
anymore.
cancer already.
okay.
Yeah,
Yes,
we're
yes.
not talking about cancer.
The cancer thing, of course, I mean, there needs to be counseling and stuff like that. But now I'm not talking about cancer. I'm talking about like regular couples. Because as we mentioned earlier on, even in a normal, regular relationship where both parties are healthy, this whole talk of sex is already a challenge.
Yes.
So to me, whatever you're talking about right now, you know, couples who you know, one of them has sex and they still feel like sex is so important to them, is mind blowing to me.
Cancer, you mean?
Yeah,
One
yeah.
of them has cancer.
Yeah, exactly. What did I say?
Sex.
Oh.
You said one of them has sex.
Okay. You know what I mean? Because
Yeah.
sex would be the last thing
On
Yeah.
their minds.
on
their
the
minds.
minds of couples who are battling with, let's say, cancer or
And even if it wasn't the last thing on their mind, even if it was the first thing on the mind, they would still not bring it up.
How do you help someone feel sexy again, though? You know, I mean, even women who have gone through childbirth, 1 baby or 10 babies, and then there's cancer on top of that for some women. How do you help them feel sexy?
Yeah, what I find is that most people, despite all the things that they're feeling when they're coming for counseling, they really want to take action. So being able to break down where they are, where they want to go, and break it down to smaller steps really helps them to feel less overwhelmed. So it's less about me giving suggestions, about them coming up with these things themselves and supporting them to feel less overwhelmed.
Like, for example, like what do they come to you with?
Like, for instance, if they want to resume penetrative sex, being able to insert, say, a bullet vibrator into their vagina to practice and see how it feels like
Right.
get to know their vagina again, I think it's very, very empowering for them.
Before moving on to the man. Is that what you mean?
Before inviting their partner in,
Right,
especially
okay.
when there are certain bad habits in the relationship, like rushing into sex too quickly, and then they feel really like
Used.
yeah, I mean, they feel they know what's going to happen already because they've been doing this all along. So how can they ask for the small steps that they need from their partner? So sometimes we
Foreplay
brainstorm,
and
we
stuff.
role play, we come up
Yeah.
with scripts.
Okay, so
Scripts. Wow. Okay.
we were talking about, obviously, there is a difference between being comfortable with your body and feeling sexy about your body. Now let's talk about the guy perspective, okay? Say from a man's perspective, I loved my wife's body. I was so accustomed to it. You know, I loved every part of her, particularly supposing her breasts. Now she's had to have a mastectomy. How do you tell the guy to still find his woman sexually attractive or sexually appealing, especially when what used to be so important to him is not there anymore?
Yeah, they say a boobs guy, ass guy.
Yeah.
So yes, it is something that they are used to, and I think sometimes we just become so attached to something and not realize that there are also other things to explore. So being able to look at the different things that they love about their partner, their wife, and being able to really internalize it, and being able to talk it through with someone like me will be useful, because sometimes there are certain things they just don't say, and actually not saying those things actually make it worse.
Yeah.
Isn't
for
there
sure.
like breast reconstruction surgery and all that?
She mentioned that earlier.
Yeah,
but it's
so-
not the same, right?
It's not the same.
Especially for the women. Is it more not the same for the women, or the men don't really care if they're fake or real? And
It was important for my mom to go through breast reconstruction. She talked about it for a long time, but actually back then when she did it, it really, how can I put it? It really turned out very bad. And there was this whole new wave of grief that she had to deal with, which is, because she went through it, she's not going to be able to do another surgery for this. And it's just never going to be what she thought would happen.
Have things improved though in that field? I mean, now implants and breast reconstruction more, I don't know, lifelike, natural feeling, natural looking than they were in the past?
I think things are better. But if you want exactly the same, it's just not going to be possible.
Yeah, but I say if you love someone, you love someone. Especially in a situation like that.
we have a few messages from Benjamin. He says, I would like to make an appointment for my wife to see Dr. Lee. How to go about it? He says my wife deprives me and has asked me to go for a massage. So Benjamin wants to know how he can get, or anyone can get in touch with you.
Yeah, it is also not about just going for a massage. I think a lot of men actually really love their wife, and they really want it with someone
wife.
that they love.
Yeah.
So yes, they can reach out to us at Singapore Cancer Society, and you can reach out to us at our website, our IG, Facebook, SG Cancer Society.
But this
Okay.
is very interesting, like what Angel just read out. Okay, the interesting thing here is that the wife is giving him permission now to go
For a massage.
with a happy ending, right? So, what do you feel of wives who say things like that? Does it mean that they are frigid?
I think a lot of times they're saying this out of
Frustration.
not just frustration, but also sadness.
Yeah.
Because they feel they cannot give it to their partner, and so it's more like a compensation, substitution. And I think sometimes, along the way we forget that sex is relational as well.
Right.
I feel it's also like a dare, because I feel like women who say that, oh my gosh,
Yeah.
don't get it from me, go get a massage, and then the men go do this
Yes,
stuff.
it's a
And-
trick.
And then they come
Don't
back
do
and
it.
they're
No,
like,
but-
how dare you
But
go
if,
for that?
if she's sincere,
Who
then
knows?
he is a lucky man.
Yeah, we don't know.
Because if you don't have permission and you are not going to be cheating on your wife,
think it's a dare.
It means
Yeah, you just
That's it.
abstain, right?
Correct,
Benjamin,
you
don't
abstain.
do it, Benjamin. It's a trick.
and you'll
Don't do it.
probably end up with prostate cancer if you
That's
abstain.
true. No, right, yes. Because it's
true.
not healthy.
It's not healthy.
Yeah.
It's
yeah.
I mean, sex is a healthy thing.
yeah.
Right? Yeah, that's why they call it blue. You know what I'm talking about. Lah. Blue what? Yeah.
Kimberly is saying scripts, because you said, role playing this and that. She said, isn't that too mechanical and made up, not very romantic?
I think what happens with a lot of people is because they're not comfortable talking about sex, they really don't have the words to express what they mean. So that's where we brainstorm during sessions and come up with words that are in their voice, so that they can practice and then articulate this with their partner.
So it works for them, their kind of language, not particularly a template script.
Yeah, I was going to say,
Go
can
and
you use
take it.
Chat GPT for this?
No.
Yes, use ChatGPT.
Oh, you can.
For your own personality? Yeah.
I think talking about sex is so therapeutic.
First thing to do.
I want you to come in every week.
Yeah,
Dr.
I want to
Mathali.
come.
Yeah, okay.
Sure.
Okay. We're going for a traffic update.
From overseas.
The Straits Times, 180 years of news you can trust. Online at straitstimes.com.
Kiss 92. All the great songs in one place. Kiss 92 traffic.
On the AYE towards the MCE at the PIE exit, look out for an accident. Also on Bishan Road towards Street 14 after Ang Mo Kio Avenue 1, avoid lane 2. A vehicle is having trouble there. And if you're around the Mountbatten Fort Road junction, look out for those traffic lights because they're not working very well. Wherever you are this morning, stay safe.
Welcome back to The Big Show and The Big Show TV. We have been speaking to sexologist Dr. Martha Lee during Breast Cancer Awareness Month, the month of October. And could you tell us a little bit more about, I do believe, a talk that you are going to be conducting very soon? This is together with the Breast Cancer Foundation and the Breast Cancer Society. Am I right?
Breast Cancer Foundation and Singapore Cancer Society.
Singapore Cancer Society.
Yes.
Okay.
So this is a collaboration. I'm so glad about it because it's a panel discussion. So people can see me in action and answer all their questions around sexuality and cancer.
Okay, fantastic. And that's happening on the 22nd of October, right?
Yes.
How can they get more information? Is
Yes.
there like a website or maybe your socials that they can go
So
to?
please follow us on SG Cancer Society on our IG, Facebook, and you'll be able to get updates.
Okay, so back to Kimberly's question about scripts. We were talking about role playing and how to sort of maybe rekindle that fire that may have burnt out. She's saying, isn't that too mechanical and too rigid and made up, not very romantic?
Yeah, it's important to say in a way that the partner can understand. So it includes being able to talk about what they are afraid of. For instance, being able to say, sweetheart, I'm really nervous about resuming sex. This is what I think. I'm willing to try. So can we try this?
Okay.
Yeah.
Yeah, that seems like a regular statement, you know?
We even mentioned, the possibility of even using AI like ChatGPT, nothing like that. And I think this is great motivation to learn how to use ChatGPT better with the right prompts. So if you're going to come up with a script, you can come up with something that fits your personality in your voice as well.
Yeah, for sure.
So
Use AI.
Let's see, Dr. Martha Lee. If the wife is not into sex, right, and then but they talk about it, the guy, let's say she asked the guy like, okay, so how many times a week do you want it or whatever? What is reasonable and what is unreasonable? Okay, let's say I say, darling, at least once a week.
He's going to take notes, right, and quote you next time.
Is that reasonable or unreasonable?
Okay, I think there's no normal. A lot of us thinks that it's important to have it at least once a week. There are couples that I know of, even once a month, they will be really, really happy. So it's also not about the quantity, but also the quality. It's also about the presence, not the resentment.
Yep.
And for a lot of clients that I work with, especially those with cancer, really being able to track their energy levels and being able to see which are the times that are better. Even scheduling it is better than nothing because there are certain logistics that may have to be in place.
Yeah, like
Okay.
putting the kids to sleep, sending the kids to the grandmother.
But once again, I wasn't talking about someone with cancer. I'm talking about regular couples.
No, I think that's what
today
she's
I'm
saying
the
as
one who'll be asking like regular, questions, and they are the ones who are asking the
The cancer
questions
ones.
with regard to the cancer ones.
But I like what you said that there is no number. I mean, it could be once a week, could be once a month, could be twice a year.
Yeah, but here's
whatever
the
it is.
interesting thing. So anyway,
What?
this is an acquaintance that I have, a friend.
You're
A
asking
friend.
for a friend.
I'm asking for a
Oh,
friend.
right.
No, but I seriously am asking for a
Sure.
friend because
Okay.
I mean, if it's me, of course I
You would
would,
say it
but
out.
I have no wife,
Yeah.
so it cannot be me. Okay, so anyway, this person is asking, rather the wife asked him like, so how many times do you want? Because I mean, they are lacking,
Okay.
sex in the relationship, right? And so he said, well, at least once a week, right? You know what she told him?
What?
No.
Oh, straight up.
So you know what I told him? I said, divorce this.
Oh.
Oh, no.
No,
That's bad advice, is it?
Yes,
Yeah.
that's terrible
How
advice.
can he be like that?
Yeah.
I mean, she cannot be like that. What she's being
Again, it's the
unreasonable.
woman's fault.
No, I think
she
they need
just
to
turned
have a-
around. She just turned around to him and said, "No."
Was she
He told me
were they
that.
coming
And
out
he
of a
was-
fight?
And he was so hurt. No?
Yeah.
Yeah.
You see? So I said, just leave her.
But I like what you said
No.
earlier, that it's not the act of having sex. It's being mindful, presence, and the quality of it.
The quality, yeah.
But yeah, I feel sorry for your friend.
Should I get him to come and see
No,
you?
yeah. I mean, if the wife says no, ask why. What can I
What
do
is the
to make
reason?
things better?
Or what can I do to make you say yes?
Right.
Maybe there's something. Maybe
Okay,
she wants
okay.
a diamond ring. Maybe
Chanel
she wants a
bag.
bag. I mean, whatever her love language could be.
Cannot be like that. Well, yeah, I buy you a bag,
But-
then you have sex with me.
But come on, I mean, she has her reasons for saying no, right? I don't want to play sex therapist, but she has her reasons for saying no. I think
Yeah,
the
find out why,
Find
and
out
then
why.
troubleshoot.
So complicated.
Troubleshoot.
None of my business, this one.
Okay, but at the end of the day, right, your bro, your good friend who's not
No,
getting any, right?
wait. weird. You see, this is how
no.
things.
No.
I didn't even say that this is my good friend.
Oh,
or
okay,
whatever. It's someone
sorry.
that I know.
I assumed. Okay,
Gossiping.
sorry.
Don't be like
good friends.
So I assume. Sorry,
Don't
I
be
got
like
that
what
wrong.
happened between me and the
Got it.
Straits Times and all the other, along the way, everything gets lost in translation.
This person that you're telling us about, okay, would he be comfortable as well, if the woman did not really want to pow chicka pow pow with him, right? And was just doing it, mechanically. He wouldn't want that. I'm sure at the end of the day, he also wants somebody who wants it as much as he does.
Oh, wow. Okay, hold on. Hold this thought. Dr. Martha Lee, will you come in next week?
I want to.
Okay, then you come in next week. We'll continue this conversation with Dr. Martha Lee, and everyone can get involved in it as well. They can text in their questions to Dr. Martha Lee. We can have a debate specifically on this particular example that I have brought up.
Yeah,
Okay?
I think it's about time that we talk about sex more.
I think so.
I think so as well.
Yeah.
Case study already picked.
All right.
Love
Thank
it.
you very much, Dr. Martha Lee, for coming in today and sharing. Means
Thank
a lot to us.
you.